Good day everyone, my name is Chris Daniel Sumawang and I am a student nurse from Tarlac State University from BSN 2B, and for today I will be performing a performance evaluation checklist about the parenteral administration of drugs intradermal route. So the purpose of our performance is it is used for allergic testing, next is for tuberculosis screening, and lastly for BCG vaccination. So we will now proceed to our assessment phase. We need to assess the patient for the following. So first is the appearance of the injection site. Um, next is the specific drug action and the expected outcome of our client. Next and lastly, for the client's knowledge about the drug action and the outcome or the response. Now we will proceed to our next step. First is we need to assess our patient. So good day po sir, my name is Chris and I am from BSN 2B and I'm a student nurse po from Tarlac State University. So for today po is mag-a-administer po ako ng syringe through intradermal route po. Okay po. And ask ko lang po sana sir if okay lang po ba sa inyo na ako po ang mag-a-administer? Okay po. And also po, I will be asking lang po if alam po ba ninyo yung magiging effect sa inyo ng ating pong medication. Okay po. So, alam naman po ba natin yung purpose po ng ating medication? Okay po. So, explain ko lang din po ulit is ang gagawin po natin ngayon is I will administer a medication po through intradermal route po. Okay po. So, you may feel po a little pain or a pain po, and there will be a wheal po or a bleb na mabubuo po upon the administration of our medication. So maliit lang naman po yun na bukol. So normal po yun kapag nag-a-administer po tayo ng intradermal route na syringe. Okay po. Okay, so for our next step, we need to proceed to our planning phase, which is we need to assemble our equipment. We do need to have an MAR or the medication drug administration order or MAR, and we will also have to have a ampule or vial of the correct medication. Also, we do need to have a clean gloves, dry and wet cotton balls, or if we have an antiseptic swab, we can use that as well. And we also do need to have a filter needle as well as the micropore tape and pen or marker. And also we do need to have a lastly is the sterile 1 ml syringe. So for this instance, there is no available 1 cc of syringe on the pharmacy, so I'll be using now as the 3 cc of syringe. Okay, we will now proceed to our next step, which is we need to check the medical or medication administration record or the MAR against the label of our ampule and our vial carefully. And to do that, we will need to read the label of our medication. First is when we have taken our medication to the medication cart. Next is before and after the withdrawal of our medication. Okay, we will now proceed to our assessment phase. So first thing that we need, our implementation phase, So what we're going to do is first is we need to perform hand hygiene and we need to observe other infection control procedures. And after that, we will be preparing our medication from the vial or the ampule that we are using. And for the drug withdrawal. So for this moment, I will be using a vial. So, okay. First is we need to perform hand hygiene. After that, we will be preparing our medication. So we will now be withdrawing our medication from our vial. So okay, so for example, this is our syringe. Okay, we will now first leave our normal syringe or our normal needle to the pocket or the sachet of our needle, and we will be inserting a filter needle. Okay, after that we will need to get our vial, and we need to place our needle about a 45-degree angle first. Then we will be moving to the 90-degree angle to insert in the insertion of our needle. Okay, one, two, three. First, we need to um, withdraw the amount of air as the equals to the amount of medication that we'll be getting from our vial. Okay, so we will be getting 1 ml. Okay, now we will insert uh, our needle. Okay, 45-degree angle going to the 90-degree angle upon insertion. Okay, after that we need to inject the air. Okay, and we need to turn our vial. Okay, and after that we will need to um, pull the plunger. Okay. After that, we need to flick our syringe to expel some air. Okay. Okay. Also, it is okay if there are leaking on the tip of our syringe. Okay, so we'll now be covering it, and we need to uh, switch it now to our uh, normal needle. So we have discarded our filter needle to the sharp container or the appropriate receptacle for sharps. Okay, now that our medication is prepared, we will move it aside first. So we are now done with our performing our hand hygiene. We will now proceed to our next step, which is we need to prepare our client. We need to introduce ourselves to our client, and we need to verify our client's identity, as well as we need to check for the client's identity band. After that, we will be explaining the procedure to our client and what he or she needs to expect upon the insertion of the syringe to his or her arms. Okay? So, good day po ma'am. My name is Chris Daniel Sumawang, and I am a student nurse po from Tarlac State University from BSN 2B. And for today po is mag-a-administer po tayo ng atin pong medication through intradermal route. Okay po. So, may I ask for your name po ma'am? Okay. So, may I ask for your birthday po? Okay. So, may I request to see your identity band po? Okay lang po? Okay. Check ko po. Okay, thank you po, Ms. Smith. So, we'll now proceed to to the explanation of our procedure. So, for today po, ma'am, as I said earlier, mag-conduct po tayo ng medication through intradermal route. So, ang mangyayari po is you may feel pain po. And upon the insertion po ng needle and administration of the needle, uh, magkakaroon po ng bleb or wheal or maliit po na bukol sa pag-administer po. So, wag po kayo mag-alala kasi normal lang po yun kasi it is normal po for intradermal route na magkakaroon po ng maliit na bukol upon the administration of the drug or the medication po. Okay po? Okay. Now we will proceed to our next step, which is we need to provide some privacy for our client, and we need to close the curtains around the bed and close the doors to the room if possible. And after that, we will need to don gloves. Okay. So for example, I have already closed the doors, the windows, as well as the curtains around the bed. We will now put on our gloves. Okay, now that we're done, we'll now proceed to our next step, which is we need to select the site or the area on the inner aspect of our patient's forearms. And it is exactly 4 fingers away from the patient's AC. So here, for example, here, we'll be injecting our client here. And after that, we will need to uh, check also if there are presence of any heavy pigmented areas on the client's skin, as well as if it is covered with hair. And if there is presence of the what I said, we will need to find another route that to inject our medication. Okay. And for this instance, as you can see here, for because our patient is a teddy bear, it is a fact that a teddy bear is hairy. So, for example, supposedly, we will need to assume that it is a real person. Okay. Now we will proceed to our next step, which is we need to cleanse our patient's selected site, and by using a wet cotton balls or the antiseptic swab that if we have one, and we need to do a firm circular motion onto the client's injection site, and we need to start on the center of the injection site to outward of the injection site for about 5 centimeters or 2 inches. Okay. So, ma'am, pupunasan ko na po inyo pong arm. Okay po. Okay. After that, we will now proceed to our next step, which is we need to we need to first to allow our client's skin to dry the area that we have applied an alcohol solution. And after that, we will need to go back to our prepared medication. Okay. And we need to remove the needle cuff using our non-dominant hand. Okay. And we need to pull it straight off. Okay. Okay. And after that, we will need to touch the patient's skin or the patient's forearms using our non-dominant hand. Okay, so we need to stretch it. Okay. And after that, we need to place the needle or we need to place the syringe almost against the client's skin. Okay. It is a 5 to 15 degrees to the client's skin with the bevel side up. Okay. Okay, and after that, we need to inject our client to the client's skin so that the needle or the point of our needle is can be seen through the skin. Okay. Okay. Now we will be inserting our needle for about 1/8 inch. Okay. 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 After that, we need to administer our medication slowly. We need first to stabilize the needle as well as the injection or the syringe, and we need to inject our medication smoothly, carefully and slowly. And okay. Okay, ready po in 3, 2, 1. Okay. Okay. After that, we need to remove or withdraw our needle and the syringe quickly at the same as the angle that we have inserted the needle. Okay. And after that, we need to make sure not to massage the area that we have injected because it will flatten the wheel that we have created. So upon the insertion of the needle, the administration of the needle, a wheel or a bleb will be produced. Okay. Now we will need to dispose or discard our needle to the appropriate receptacle or our sharp container. Okay. And after that, we will now proceed to our next step, which is we need to remove our gloves. Okay. After removing our gloves, we will need to perform hand hygiene. Okay. And after that, we will need to, using a pen or a marker, we will be using or writing or drawing around the wheel or the bleb that we have created on the client's forearms. Okay, so we will use the marker and mark around the bleb or the wheel. Okay, so for example, I have already drawn the circle around the our client's wheel. After that, we will now proceed to the next step, which is we need to write in a micropore tape the name of the drug or the medication that we have administered to our client, and also we need to write also the due time that we'll need to check the patient for the reaction of the medication to the client's skin. Okay, we'll be using a micropore. Okay. So after that, we'll be writing the client's the medication, the name of the medication. As well as the time that we will be back to check for the reaction. So for example, we have administered the medication for at 8:30 in the morning. We will be going back to our client for the checking again of our client's reaction at 9 o'clock. Okay, 9 p.m. Okay, and that is for our performance. We will now proceed to our evaluation phase. So for our evaluation, we need to document our the medication of the administered medication, as well as the site, the time, the dosage, the route, as well as the nursing assessment. And we need to lastly, we need to observe for possible reactions of our client of our administered medication. And that would be all for the assessment or the performance of the parenteral administration through intradermal route. Again, my name is Chris Daniel M. Sumawang, and I am a student nurse from Tarlac State University from BSN 2B. Thank you.